Okay, I wanted to show you what I've been doing to deal with my recent injury. I injured my left knee, about 12 days ago. I don't know if you can see the difference. It's really swollen. As you can see, my right knee is fine. I have tattoos here. That's what that is. But you can see the definition when flexing here, pretty amorphic. Can't really see too much definition. Very swollen, extremely painful over the past few days, past week and a half. And so it actually is getting a little bit better. Last night and today, markedly better. I have been staying off of it, and I wanted to show you some of the things I've been doing to expedite my healing. I should say, what I've been doing in the hopes of expediting my healing. So first of all, I'm wearing this brace, DonJoy. DonJoy brace, it's fantastic. It's silicone, and it just goes on the knee like this, Velcros in the back. It provides support when I need to be mobile and walking around. It takes pressure off. As you can see, a little pattern here to help defray the pressure on the skin. It does leave a little pattern on the skin, but I don't mind that. So I have been applying Arnicare probably about 3 times a day. I like the gel form. I put it on, really slather it on about, like I said, 3 times a day. What I wanted to show you now is some implements I've been using to help with the healing. So I'm a licensed acupuncturist of about 20 years now, and about 3 or 4 years into practicing, a colleague of mine had told me about the Dolphin Neurostim, which at that time was called the ETPS. And so I purchased them and I utilized them for patients and myself. Incredibly effective for neuromuscular and musculoskeletal pain, but for so much more. Scar release, post-operative, tending to helping move things along to help you heal up. So anyhow, I'm going to show you the protocols I've been doing now. I'm trained with these. I've had, a series of trainings with the Dolphin Neurostim. So they're handheld instruments here. They're FDA-approved. Fascinating story with these. Back in 2020 during COVID, they were approved for use in Canada in the hospitals for treating long COVID. Yep, that's right. It's because of their ability to address the cytokine storms, and I'll include the study. There's a great PubMed study that talks about this. They were able to downregulate or help the vagus nerve normalize in response to the cytokine storms that were infiltrating these patients with long COVID effectively. I mean, they did the studies and they knew it was helping, so they let it into the hospitals there for treatment. So I do have the implements for helping with the vagus nerve treatment. That's going to be for another session here, but I just wanted to show how instrumental they are with helping with injuries and helping expedite healing. So I'm going to be turning them on the other side. Need to keep my skin, it's a grounding aspect of this. There's a couple adjustments back here. And so these apply or emit electromagnetic current at a very specific amplitude in a very specific fashion. And when done properly by a trained individual and knowing where to treat is really key. So where I'll be treating today is both in acupuncture points and on what's known as she points, which means that's it, that's where it hurts points. So actually anywhere around the knee is going to be a good place to treat for me because it's very swollen, very sore, or has been, still very swollen. I have been icing. I know you might say, why are you icing if you're of the natural healing community? But I went to the orthopedist and his term was aggressively ice. I'm doing whatever I can to try to balance this out and get this healed up. And so far, it's actually moving along pretty well. I got an MRI yesterday, and we'll know the results of that to understand the extent of my injury. The good news is, the doctor pointed out, from an examination. There's no torn MCL or ACL. He just doesn't know exactly what I did and to what extent, but that's why we did the MRI. So just like I said, doing some acupuncture points here. Gallbladder 34, spleen 9. And anything around the knee is going to be good. Stomach 36, spleen 9. Can't hurt to give a little digestive treatment too, right? And anyway, just wanted you to see some of the different treatments I've been doing to help expedite my knee healing. I feel these have been extreme. I've been doing this about 3 to 4 times a day. I can do that because I have a set. Now, where can you get this done? There are certain providers that are authorized to use these. The professions, I'm not sure which professions. I know acupuncturists, I think physical therapists. I'm not sure, but you can Google this and find out who is able to provide you with Dolphin Neurostim treatment. And it can be so instrumental if you're injured to help you heal up naturally. And I hope you enjoyed watching. If you have any questions, let me know. And I'll be doing some more about the Dolphin stem in the future. Thank you for watching.